We want to get right into it today, talking about West Nile virus, and the state's health department now is saying they're considering this an outbreak of the virus, and that has many of you, and me too, wondering how do you stay protected and who is most at risk to get sick. So News 19's Nate Stanley went out today to listen to people's concerns and also to speak to an expert to answer some questions. He joins us live in the studio with the latest. Nate, what'd you find out?
Andrea, that doctor tells me that DHEC is about to send some updated information to physicians' offices about those possible cases right now. I also spoke to people today who had a number of concerns.
You know, mosquitoes haven't bothered me much, but when they're carrying a virus like West Nile, I'm more alert.
James Morris lives on Main Street in Columbia. He's been following the increase of West Nile virus cases in South Carolina for weeks, including that one person who died in Richland County.
I think it's terrible, it's scary.
Morris worries about the impacts of the virus and how common it is in Richland County.
How common is this in the bird population, and how common is it in the mosquito population?
According to DHEC's mosquito-borne disease tracker, 35 mosquitoes have been found in Richland County with the virus this year. Chan Ogoa says she first heard about the virus in the last couple of days. She now wants to know the best ways to be.
Really, is there a vaccine for it? Is there anything we can do to prevent it?
According to Brandon Trexler from SCDHEC, there is not currently a vaccine offered for the West Nile virus. But there are a handful of ways you can limit your chances of getting the virus.
The biggest thing is on your property outdoors, not having standing water. Then personally, also wearing long sleeves, long pants, wearing mosquito repellent, particularly that contains DEET.
She said after you get bit, it could take 2 days to 14 days to show symptoms, which include puffy eyes and a fever. Hank Wynn has been following West Nile virus updates from around the country and spoke about the rumors for who's most at risk.
Particularly dangerous to pregnant women, but not particularly dangerous to people who are healthy.
Though partially true, Trexler adds that anyone can be bitten by mosquitoes and thus runs the risk of getting symptoms.
It is really just a matter of whether you unfortunately get bitten by one that is infected.
Yeah, and Richland County did say, or Trexler rather, said that the term outbreak for this scenario came after there were 6 active cases announced. Live in studio, I'm Nate Stanley. Andrea?
All right, Nate, thank you so much for that update. It's good to see the spraying going on. So besides getting a mosquito bite, how do you know if you might have contracted West Nile virus? Well, get this, 8 out of 10 people, that's pretty incredible, with the virus don't even have any symptoms. So you could have the virus and 8 out of 10 of you might not even know it. So symptoms can show up anywhere between 2 days and 2 weeks. So that's a pretty big period, right? All right, here's another fact for you today. About 1 in 5 people who are infected will develop a fever with other symptoms like headache or body aches or joint pains. Now, you can also have intestinal problems with West Nile virus. So that's talking about things like vomiting or diarrhea. You can also have a skin rash, but most people with mild cases do recover completely. But fatigue and weakness can last for weeks longer or perhaps even months. So let's give you even more information now. About 1 in 150 people who are infected do develop a severe illness. So what does a severe illness look like? What are some of the things that you should be looking at? Well, here's the list for you. This is things like a high fever, a headache, neck stiffness, being disoriented, perhaps even as far as being in a coma, having muscle weakness, vision loss, numbness, paralysis. Now, people who are over age 60, along with those who have certain medical conditions, they are at a greater risk for developing severe illness like many other viruses. Recovery could take several weeks or months, and some of those side effects could unfortunately be permanent. So where are we on a vaccine? Well, there is no vaccine or even specific medicine right now for West Nile virus. They say that you should take over-the-counter pain medicine that can be used to reduce your fever and also relieve some symptoms. In severe cases, patients often need to be hospitalized to receive supportive treatment. Now, if you think you or a family member might have West Nile virus, you should call your doctor immediately. And for the very latest on West Nile and to get updated numbers, check out our website, WLTX.com.